Good afternoon. Yeah, I guess you guys still think it's morning. Been sitting here for quite a while, and I promise you I'm not going to be long because I've learned that you don't stand between people and food. So lunch is right after this, and being the last person, I know I can't speak as fast as Lisa did. Did you guys see that? You know, so, but I am Clarese Holden, and I'm actually a stand-in for our center director, Director Fran Harding, for the Center for Substance Abuse Prevention at SAMHSA. And today we also have our the Prevention National Advisory Council meeting today. That's why she's not here. And so I'm hoping that I'm going to be a good stand-in for her. I've listened to many of these, the developers and then our state folk, and being the one coming from the federal government, after 30-some years, I've been telling everybody, you know, that I'm not a bureaucrat, and I don't play one on TV either. I'm just a person who believes that if we put the right programs in place, or if we focus on the outcomes that we get that are positive outcomes, and we can sustain those outcomes, that we really are helping our states and our communities in moving forward the needle in which they're trying to move when it comes to scaling family folks preventive interventions. So I'm going to probably have the same problem of moving. No, I did pretty good, okay, in moving these. First, I also want to thank Pat, too. We've worked together on some ventures, and so it's good to be here. Today, I'm going to share with you the vision of the agency that SAMHSA has. That there is an urgency of addressing behavioral health issues in our communities in a comprehensive manner. Also, and to present some opportunities and challenges of bringing evidence-based practices to scale. SAMHSA's vision is for a nation that understands and acts on the knowledge that, one, behavioral health is essential to health. Prevention certainly works. Treatment is effective, and people do recover. We use this vision to guide our efforts to align behavioral health and primary care services. It also helps us to speak a common language when we work with communities, states, and with our national and federal partners. When I first came to SAMHSA, it was not SAMHSA, it was ADAMHA, and we had, we were telling our states and communities at that time that they need to partner with other agencies and organizations in order to get what they needed done. And we ourselves were sitting there not having any partners. At this time, at SAMHSA and at CSAB, we have numerous partners. I believe we have 19 federal partners that we're working with now, as opposed to the 2 or 3 that we work with in the past. Collectively, SAMHSA's strategic initiatives support 3 key aims of the Department of Health and Human Services. I'm sorry. One is to improve the nation's behavioral health, to transform healthcare in America, and to achieve excellence in operations. We're looking at and calling ourselves the Public Health Agency and the Public Health Approach. At SAMHSA, we integrate substance abuse prevention with a broader public health framework. Our approach reflects the Institute of Medicine's 3 classifications of prevention, which focus on target populations and the degree of risk that they face. This opens up an opportunity to unite a wide range of educational, safety, youth-focused, and community-building initiatives with strategies to preempt substance abuse and mental illness. One of the things that we certainly pay a great deal of attention to is capacity building. We have had, we came up with, many of our states was using in getting to outcomes, which is a 10-step process that they used. And we decided that we needed to come up with a planning process because we didn't want to burden the states and communities with a lot of steps and processes and things that they had to go through. So we came up with the Strategic Prevention Framework, which is a 5-step process that we have our states to go through. When we came up with this Strategic Prevention Framework, we thought about how we had been given the funds that Congress gives to us to give to the states and communities on how we could better get those funds out from the state to the communities in a quick way. One time we used to just go and fund communities directly. We still fund communities at SAMHSA, but we also fund the states. And one of the things that we decided was that if we could get the governor of the state to buy into the prevention of substance abuse, we could actually get a better bang for our dollars that we gave to the state. We would send our dollars to the state before asking the governors to be a part of it. We would send our dollars directly to this, the state agency, to the state authority, single state authority, and to the National Prevention Network person. And so they would then funnel the dollars to the state communities. But once we decided to come up with a strategic prevention framework, state incentive grant, that we would educate the governors and make sure that they would have a buy-in. So what we did was we said, okay, governor, if we fund your state with dollars for prevention, would you in turn provide us with an advisory council that would come up with a plan, a strategic plan, a comprehensive strategic plan for prevention across the state, rather than having funds just go arbitrarily to whomever you decide to give those funds to. And so most of the governors, matter of fact, all of the governors, and we also fund tribes too, and jurisdictions. They agreed when we put the application out there, and they agreed, and so they built this advisory council that contained a lot of the partners, that had a lot of the partners and organizations and agencies within the state that would talk about where these funds would go, and the 5 steps, how they would institute these 5 steps, or how they would implement them. So the first step was assessment. The second, I'm sorry. Oops, I'm sorry. That's what I always do. Forget to move my slides here. Okay. I think I'm gone too far now. Okay. Let me go. Okay. There we go. Okay, I'm still here. Okay. One of the things is that we looked at the 5 steps: assessment, capacity building, planning, implementation, and evaluation, and also to help the states to not forget about cultural competence and sustainability. And we didn't always talk about sustainability of sustaining the programs themselves, but at least sustaining some of the outcomes. The strategic prevention framework promotes a systems-based approach to substance abuse prevention. It allows states, tribes, and communities to build capacity and sustain a culturally competent infrastructure. The SPIF is an example of outcome-based prevention. The SPIF was designed to systematically collect, analyze, interpret, and apply findings from epidemiological and community readiness data about substance use and the consequences. The SPIF requires evidence-based programs, policies, and practices as the basis for their program implementation, and the SPIF encourage community-level change. Okay. Just wanted to say that I didn't have that in my report, but I heard the SPIF said many times throughout, and I just wanted to explain to you what that really is. And so we have funded every state with a SPIF, 9 territories, and we have funded 5 cohorts of SPIF SIGs. We are also funding Partnerships for Success, which I call the son of SPIF. And now in 2014, and we're funding a third cohort of PFS, Partnerships for Success, and we're already planning to figure out what's going to be next. So we're being asked at SAMHSA now, you guys come up with what's next so that we can get the funds to fund the states and the communities, because Congress does not just give us funds, and they don't look at, they will not listen to us making these kinds of speeches for sure. When we stand before them, they're looking for data and how much is it going to cost. And that's how we in the federal government get money to give to the states and communities. So we have to come up with data. Now, our states have to go through this 5-step process, but then the communities that they select also have to go through the 5 steps. And the communities have to address the highest priorities that the state has, but they also may address some of the priorities that they come up with their needs assessment as well. So we are trying our best to make sure that our states have ownership, take ownership, and then in turn they give the ownership to the programs at the community level so that they are able to do what they need to do for their communities. States are different as well as communities are different, and so we cannot have a cookie cutter approach to all of the states and communities that are out there. So they're building their own strategic prevention comprehensive plan across the states. We now have 50 plans for prevention across the states and 9 in the territories, and then we have, I believe, 16 tribes that have strategic prevention framework. One of SAMHSA's #1 strategic initiative is the prevention of substance abuse and mental illness, and we have 4 goals for this strategic initiative. Goal 1 calls for the range, just want to make sure. Goal 1 calls for the range of responses to address substance abuse and mental health conditions. Goal 2 addresses underage drinking and adult problem drinking. Goal 3 focuses on preventing suicides and suicide attempts among several populations that are at high risk. And Goal 4 focuses on preventing the misuse and abuse of prescription drugs. As you know, that's a problem that we're facing now, prescription drug abuse, and marijuana, now that marijuana is legal in a couple of states, we're also gearing up to address some of those issues that's going to come with that. So we're working very hard at SAMHSA to make sure that we're addressing all of these needs. I always tell our administrator whenever I get a chance to talk to her, I said, you know, we're touching on many things, but at some point in time, we're going to have to land this plane and focus on something that's working that we can really do and make it work for the states and our communities. Let's see. We have the science. One time when I first started working in prevention, you know, science was almost null and void, but we do have some science. And we're moving from research to practice. From partnership-based research, there are 4 factors important to consider when considering translation of preventive interventions, regardless of whether these interventions focus on the family or another contextual domain. Effectiveness in interventions. Does this really work? Extensiveness of their coverage of all populations potentially benefiting. Who does it work for? We need to ask ourselves these questions. Is this going to be cost effective? And then 4, engagement of populations and quality of intervention implementation with them. We must think about the fidelity of the programs. Okay, let's see if I can quickly move. Part of the scaling up is to find new partners for alignment, collaboration, and integration of services, and using the funds we have in a strategic manner. Now, one of the things that we're doing at SAMHSA is we're now working across, like I said earlier, where when I first started working in the government, we didn't have very many partners. But we also did not partner ourselves across centers, and we were in the same building, and we were on different floors. And so now we've come to the knowledge, hit us over the head like a clunk, that, hey, you guys need to be talking to each other. So in 2012, we decided that it was a good policy to not burden the states with our block grant. We have a substance abuse block grant, which covers prevention and treatment, and a mental health block grant. So we used to have 1 application for substance abuse and 1 application for mental health. And now we've combined the application. The application goes out to the states and the territories and 1 tribe as 1 application. So now we are moving, and we're trying very hard to make sure that we're tweeting, and I think somebody said it over here, tweeting the block grant to scale up to the needs and capacity of the particular interventions. So we have moved the SPIF into the block grant. And so the states now are operating on 1 comprehensive plan for prevention across the states and our territories as well. I don't want to leave them out. Okay. Let me see. Just wanted to say a couple of words about the block grant, and then I'll move on. The goals of the block grant programs are consistent with Samsons Vision for a high-quality, self-directed, and a satisfying life. And the components of the healthy life are the dimension of recovery, a physically and emotionally healthy lifestyle, a stable, safe, and supported place to live, have a home, meaningful daily activities such as a job, school, volunteerism, family caretaking, and a creative endeavors, and the independence, income, and resources to participate in society. And that's having a purpose in life. Relationships and social network that provide support, friendship, love, and hope, and that is a community. Okay, let's see. Then I'm going to move forward to talk a little bit about Project Launch, which is linking actions for unmet needs in children. I said earlier that we did not talk to each other, even at SAMHSA at one point, but we're doing a lot of talking now across centers. And one of the projects that we are collaborating on and coordinating together is Project Launch. The goal of Project Launch is to foster the healthy development and wellness of all young children, birth through age 8, preparing them to thrive in school and beyond. This SAMHSA program is led by our Center for Mental Health Services in collaboration with the Center for Substance Abuse Prevention. And it exemplifies the type of collaboration SAMHSA is encouraging at the state and community levels. Project Launch is a 5-year grant program. We have Project Launch in 40 states. Tribes and communities have been funded since 2008. We fund to state Title V and mental health agencies. State tribes picks up the pilot community to partner with, and there's a dual focus on systems improvement and implementation of evidence-based prevention and promotion practices. Project Launch, some of the key concepts is it's early childhood focused. Prevention and wellness promotion is not treatment, it's prevention. Expanding and enhancing, not reinventing. Linking across sectors is highly collaborative. The state, territorial, and tribal and local partnerships are forming, and we're infusing mental health knowledge and expertise into all of our early childhood settings. Project Launch, some of the outcomes of one state, Maine in particular. Project Launch promotes children's wellness through from birth to 8. In Maine, its project was funded in 2008, and it targets one of its rural and highly impoverished counties, supports families with high-risk pregnancies, and the data shows some promising results. As you can see, the rates of adequate prenatal care for teen mothers aged 12 to 19 rose from 62% to 85% 4 years into this grant. And this is an example of a positive outcomes from one of our grantees funded under this grant program. The state of Maine's grant focuses on improving maternal and child health and the outcomes that they get. So in this one rural area where it's highly impoverished, the services provided was integration of infant mental health and family support specialists into rural and tribal health centers, including pediatrics, obstetrics, gynecology, and family practices. Support services for families with high-risk pregnancies and complex challenges, often involving a history of substance abuse, and data from a study of the program showing promising results. And so we're really very proud of this program because we are definitely collaborating and coordinating this program across SAMHSA. Okay, I think that my red light means that I am done, right? So you guys can stick a fork in me and turn me over. I'm done. The other things that I was going to say, I don't think that well, let me finish with one thing. There's a dual focus to Project Launch, and there's 5 strategies: screening and assessment in a range of child-serving settings, family strengthening, mental health consultation and early care and education, integration of behavioral health into primary care, which we're struggling with. We're trying to do that, but we're working on it fervently. Enhanced home visiting with a focus on social and emotional well-being. And then just wanted to, I was going to leave you with our website, but I think that it's on one of these. Well, I don't think so. Well, okay. I'm back to one. Thank you so very much.